I want you to do something before I say anything else. Look at your hands, not a quick glance. Actually, look, both hands flat in front of you in good light. Look at the color of your nails. Are they a healthy pink or do they look pale? Almost white near the base. Now look at the surface. Is it smooth or do you see ridges, lines running across the nail, not along it? Look at the edges. Do they chip easily? Do they peel in layers? Do they break at the slightest pressure? Most people over 60 have noticed something changing about their nails over the past few years and quietly filed it away under getting older. A little brittleness, a little more breakage, perhaps slower growth. I understand why that conclusion feels reasonable. But here's what I want you to consider. What if those nails aren't telling you something about aging? What if they're telling you something about your gut? Because in my years of practice, the connection between nail changes and intestinal health is one of the most consistent patterns I've observed and one of the least discussed in a standard appointment. It gets overlooked because nails seem cosmetic. They seem separate from digestion. They seem unrelated. They're not. There are 4 specific gut conditions that can show up in your nails before they announce themselves anywhere else. Sometimes months before any obvious digestive symptom appears. I'm going to walk you through all 4 of them today because understanding this connection can change what you notice and what you decide to ask your doctor about. But first, I want to make sure you understand why nails say anything at all about the gut. Because without that foundation, the rest of this video won't carry the weight it should. And near the end, I'm going to give you something specific, a way to look at your own hands right now in this moment and know whether what you're seeing is worth a conversation with your doctor. A real decision framework, not vague advice. Stay with me for that. Hello, I'm Dr. Rose. I've been in clinical practice for 12 years, and this channel is where I talk about the signals your body is already sending, the ones that often get dismissed as just aging when they actually deserve attention. If you've been watching for a while, you know that's the work we do here. We slow down on the things that tend to get rushed past. If this is your first time here and this topic is the kind of thing that made you stop, subscribe. This is exactly the kind of conversation we have every week. Now, let's get into it. Here's something most people don't fully appreciate about nails. They're not decorative, they're structural. And building them requires a continuous supply of raw materials. Keratin is the primary protein that forms the nail plate, but producing it requires a constant flow of supporting nutrients, iron, zinc, biotin, vitamin B12, vitamin D, protein, and several minerals your body needs to pull from food every single day. That process doesn't start in your fingertips. That starts in your gut. More specifically, it starts at the wall of the small intestine, the tissue that decides what gets absorbed into the bloodstream and what gets passed along as waste. When that lining is healthy and functioning well, nutrients move efficiently from your food into circulation and eventually reach the tissues that depend on them, including the matrix at the base of each nail where new nail cells form continuously. When that lining is struggling for any reason, the supply chain breaks down. Quietly, not all at once. Gradually over weeks and months. And the nails, because they grow slowly and are made of material that takes time to form, preserve a kind of record of that disruption. Think of them the way you might think of growth rings in a tree. Each layer of nail growing out reflects the conditions that existed in the body at the time it formed it. When something goes wrong in the gut, when absorption drops, when inflammation interferes, when nutrient delivery is compromised, that disruption can embed itself in the nail structure, and then it grows outward slowly, visibly, if you know how to read it. What you're looking at isn't just surface, it's history. Now, what matters especially here is what changes after 60. The stomach produces less acid, and acid is how the body releases nutrients from food in the first place. The intestinal lining becomes less efficient at absorption. The microbiome changes in composition and diversity. Low-grade inflammation becomes more common and easier to miss. Medications that many older adults take regularly, particularly acid reducers, can affect the absorption of B12, iron, and magnesium over time. All of this means that the gap between eating enough and absorbing enough can widen significantly in the years after 60 without the person feeling anything they would describe as a digestive problem. The nails see it before the gut announces it. My father A quiet, methodical man used to say that the most important things are always visible before anyone decides to look. I've thought about that often in clinical practice. The body is rarely silent about what's happening inside it. It just speaks in a language most people haven't been taught to read. That's exactly why the four conditions I'm about to describe matter so much for anyone in this stage of life, and why the observation you'll do at the end of this video is worth treating as seriously as any annual lab test. Let me start with the first. The first condition doesn't have a dramatic name. It rarely gets its own headline, but it may be the most common gut-related explanation for nail changes in people over 60. Intestinal malabsorption. Not a disease with loud symptoms, not something that shows up on your face or announces itself with obvious pain. Just a quiet, progressive failure of the intestinal lining to extract what it should from the food you're eating, even when you're eating reasonably well. I had a patient who came in for a routine visit. She was 67, relatively active, no major complaints. But when I looked at her hands, her nails were thin, almost pliable, bending under slight pressure rather than holding firm. They were breaking at the tips. The surface had a dull, slightly ridged texture. She'd been noticing it for 2 years. Her conclusion, getting older. When I asked about energy, she mentioned, almost in passing, that she felt tired more often than she used to, that her hair had thinned somewhat, that she didn't feel quite as strong lifting things around the house. She had no digestive complaints. Her bowels were regular. She wasn't in pain. Her gut seemed fine to her. When we ran labs, her ferritin was low. Her B12 was at the very bottom of normal. Her zinc was deficient. She was eating. The nutrients were going in. They simply weren't being absorbed at the level her body required. This is exactly how malabsorption presents in many patients after 60. Not as a digestive crisis, but as a slow, quiet deficit that surfaces first in the tissues most dependent on a steady nutrient supply. What causes it? Several. Converging factors. Reduced stomach acid impairs the breakdown of proteins and the release of iron, B12, and zinc from food. A less efficient intestinal lining absorbs less per pass. Chronic low-grade inflammation, even without pain, disrupts cellular absorption at the mucosal level, and medications taken for years can quietly deplete specific nutrients. The nail matrix depends on the nail. Presentation of malabsorption tends to be diffuse and gradual. Nails that bend rather than snap. Nails that peel in thin layers. Growth that is slowed noticeably. A general loss of surface gloss. No single dramatic sign, but a pattern that taken together points toward the gut before it points anywhere else. Here's what I want you to hold on to before we go further. The changes I just described are ones most people rationalize individually. The brittleness is age. The paler is just my skin tone. The slow growth is probably nothing. But patterns have meaning that individual signs don't. If 2 or 3 of those features are those present together, same nails, same hands, that pattern is worth looking at more carefully. Which brings me to the second condition. And this one tends to surprise people when I raise it in the context of nail changes, because most people assume they would know if they had it. When most people picture celiac disease, they imagine a younger person. Severe abdominal pain, chronic diarrhea, obvious weight loss. That presentation is real. But after 60, celiac disease can look entirely different. In older adults, the intestinal inflammation caused by gluten often presents subtly, sometimes almost silently from a digestive standpoint. What surfaces instead is anemia that doesn't improve well with iron supplementation, bone density loss that seems disproportionate to age, persistent fatigue that rest doesn't fix, and nails that are chronically pale, fragile, or shaped differently than they used to be. Let me be specific about one nail pattern in particular. Koanisha, what clinicians call spooning, is when the nail curves and the upward at the edges, rather than lying flat, creating a concave shape. This is a recognized clinical sign of iron deficiency anemia. An iron deficiency is one of the most consistent downstream effects of undiagnosed celiac disease because the part of the intestine most damaged by gluten, the duodenum and upper portion of the small intestine, is precisely where the body absorbs iron. I want to slow down here because this detail matters more than it might seem. If you've been told your iron is low and iron supplements haven't significantly moved the number, or if they improve it temporarily and the level keeps falling, that pattern is worth investigating further. Not because it always means celiac disease, but because it points to a gut that is not absorbing iron efficiently, regardless of how much iron is going in. Other nail signs that can appear with long-standing gluten sensitivity include persistent pallor across the entire nail bed, brittleness that doesn't respond to biotin or topical treatments, white spots, or a milky discoloration that persists over time, and in some cases, a general thinning of the nail plate that progresses gradually over years. The difficulty after 60 is that the gut symptoms can be muted. The intestinal damage continues, and without the classic presentation, neither the patient nor the clinician connects the nail changes to what's happening in the small intestine. I have seen this pattern enough times that I now routinely ask about nail changes when a patient comes in with unexplained anemia or iron deficiency that isn't responding to supplementation. The gut is usually the better place to look. This is the part most people miss. And missing it means the inflammation continues quietly for years while the body keeps trying to signal through what it has available. The third condition is where things become more specific. And I'll be honest with you, it's the one that changed the way I read nails in practice because it introduced me to something most people have never heard of. And once you understand it, you'll never look at your hands quite the same way again. Before I go on, if what I've described so far sounds familiar, if you've been wondering whether your gut is truly absorbing what it should, I want to point you to something I've placed in the description below. It's a resource I specifically selected for people who feel like their digestive health, nutrient absorption, or gut balance needs more structured attention than it's been getting. If that resonates, check the link below. But wait and listen first to what I have to tell you next, because what I'm about to explain is the piece of this conversation that I think matters most. This is the condition that changed the way I look at nails in clinical practice. Chronic intestinal inflammation, including conditions like Crohn's disease, ulcerative colitis, and other persistent inflammatory states that can develop and progress over years before anyone formally identifies them. Here's what I need you to understand, too, about inflammation and nails. And I want you to stay with this because it's one of those things that once you know it, you'll start seeing everywhere. When the body goes through an intense period of physiological stress, a severe infection, a prolonged episode of diarrhea, a significant nutritional crisis, the nail matrix temporarily slows its production. The cells that form the nail plate reorganize their priorities. The structural quality changes weeks or months later. That change becomes visible on the surface of the nail as a horizontal line, a groove, a ridge that runs across the nail from side to side. These are called Bowes lines. And what makes them significant in the context of chronic intestinal inflammation is this. They don't appear on just one nail. When the disruption is systemic, when the body as a whole has been affected, they appear across multiple nails simultaneously, all of them registering the same event at the same time, growing out at the same pace. Think about what that means. Your nails are not reflecting what's happening right now. They are keeping a record of what happened months ago when the gut was struggling in a way the person may never have consciously registered as a health crisis. I had a patient in his mid-60s, attentive to his health, generally active. He mentioned, almost as an afterthought toward the end of an appointment, that he'd noticed lines across several nails. He assumed it was age or something he'd knocked against and forgotten. When I looked carefully, there were two distinct horizontal ridges on multiple nails. Not one event, two separated by roughly 4 to 5 months based on where the ridges sat along the nail length. He recalled some periods of low energy, some bloating that had come and gone, nothing that had alarmed him, nothing he would have called a health event. But his nails had registered 2 separate episodes of systemic stress, and the investigation that followed revealed chronic intestinal inflammation significant enough to periodically compromise nutrient delivery and cellular renewal, quiet enough that the patient had adapted to it without realizing it was ongoing. This is what I'm going to ask you to carry from this section. Chronic gut inflammation does not always produce obvious pain. It can run quietly for years. The body compensates, adapts, continues while the inflammation persists beneath the threshold of conscious suffering. And the nails, with their slow structured growth and their sensitivity to systemic disruption, can preserve a timeline of that struggle, a timeline you can see if you you know how to read it. The fourth condition is one I want to address specifically for people who have been on acid reducing medications for an extended period, who eat less protein than they once did, or who have noticed their digestion has simply become slower and heavier over the past few years. The fourth condition is gut dysbiosis, and its more specific form, SIBO, small intestinal bacterial overgrowth. Your gut microbiome is not a passive resident. It participates actively in digestion, helping to break down food, produce certain vitamins like B12 and K2, and transform nutrients into forms the body can actually absorb. When that community is healthy and diverse, it supports the entire absorption process. When it falls out of balance, the effects are not always confined to the digestive tract. They show up elsewhere in energy, in skin quality, in the way your thinking feels, and in your nails. Several things that become more common after 60 can significantly shift the microbiome. The stomach produces less acid, and that acid is one of the key checks on bacterial overgrowth in the upper intestine. Long-term use of acid-suppressing medications reduces that protection further. Slower intestinal motility gives bacteria more time to multiply in places they shouldn't. Less dietary variety, more common than people realize in older adults, reduces microbial diversity. Lower protein intake affects the bacterial populations that depend on amino acids to thrive. The nail presentation with dysbiosis is often less visually specific than what I described with the other three conditions. Not a dramatic shape change, not a striking pore. More of a quality shift, brittleness that seems like a baseline rather than a recent development. A dullness or opacity that the nails seem to have quietly settled into. A general fragility that doesn't respond to biotin, to supplements, or to dietary adjustments. What I've observed clinically is that people with long-standing dysbiosis often present with a cluster of quiet complaints. Not one dramatic symptom, but several things that have gradually become normal. Fatigue that runs in the background. Bloating they've stopped mentioning because they've gotten used to it. Skin that's drier than it used to be. Nails that have become fragile over the past year or two without a clear trigger. No single complaint dramatic enough to drive them to a doctor. But together, those signals are describing a gut ecosystem that isn't functioning at the level it should. And here's where everything I've said today begins to connect. Because what's common to all four of these conditions, malabsorption, celiac disease, chronic inflammation, and dysbiosis, is one central reality. The gut is not delivering what the body needs, and the nails forming slowly from what the bloodstream provides register that shortfall before most people notice it anywhere else. That's the connection I wanted you to understand. Now, let me make this practical. Go to a window or a bright light. Look at both hands flat in front of you. I want you to check 5 specific things. First, color. Look at the nail bed, the area beneath the nail itself. It should appear pink and relatively uniform. If it looks pale, whitish, grayish, or noticeably lighter than it was a couple of years ago, that's worth noting. POR, that appears across multiple nails simultaneously, not just one, is a more meaningful signal than a single pale nail. Second, surface texture. Run your finger across the nail from side to side, not along it. A smooth surface is normal. Fine vertical ridges running from base to tip are common with age and usually not concerning. But if you feel horizontal ridges running across the nail from side to side, that's a different signal. Those represent disruptions in nail growth that occurred weeks or months ago. Pay particular attention if they appear across multiple nails at the same location along the nail. Third, structural strength. Press gently on the center of the nail. A healthy nail has resistance. It shouldn't flex noticeably. If yours bend easily, split lengthwise, or break at the tip with very little force, that structural weakness often reflects nutrient deficiency at the cellular level. And that story, as you now understand, starts in the gut. Fourth, shape. Look at the nail from the side. Does it lie flat, or does it curve upward at the edges, becoming concave, almost like a shallow spoon? Spoon-shaped nails are a recognized clinical sign of iron deficiency. And iron deficiency after 60, as I described earlier, often traces back to absorption problems rather than dietary insufficiency. Fifth pattern, Fifth, over time. This is the one most people haven't done, and it may be the most important. Take a photograph of your nails today, both hands, in good natural light. Date the image. Put it somewhere you can find in 8 weeks. Gradual changes are the hardest to notice when you see your hands every morning. The brain adapts to small shifts. It normalizes what it sees repeatedly, which is exactly what you don't want when you're trying to detect a slow-moving process. A photograph removes that adaptation. It gives you a reference point that doesn't accommodate. Now look at these nail observations alongside what you know about your digestion. Not dramatic symptoms, subtle ones. Bloating that has become so routine you've stopped mentioning it. Feeling full sooner than you used to. Digestion that feels heavier or slower after meals. Bowel habits that have quietly shifted. Foods that now cause discomfort that didn't used to. Here's the threshold I want to leave you with. If you notice 2 or more of the nail changes I described, palaire, horizontal ridging, structural fragility, spoon shape, and you can recognize at least one of those digestive patterns alongside them, that combination is worth bringing to your doctor. Specifically worth requesting a hemoglobin, ferritin, B12, vitamin D, zinc, albumin, and basic inflammatory markers. These are not unusual tests, they're standard. They simply need to be requested specifically because no routine visit will order all of them unless you ask, and they can catch something at a stage where the intervention is simpler and the options are wider. I want to leave you with one thought. The nails are not a diagnostic tool. They don't tell you which condition you have or how serious it is. That's not the point of this conversation. The point is that your nails are always there every morning, visible without equipment, without a lab, without an appointment. They grow slowly enough to carry information from weeks and months ago. And after 60, and when the gut becomes quieter in its dysfunction, when absorption problems develop without fanfare, when inflammation can run without obvious pain, they can be one of the few places the body leaves a trace of what's happening inside.